So, I want to talk a little bit about my 1 year anniversary from my weight loss surgery. So, I'm actually a little more than a year out. I underwent a gastric bypass on November 3rd, 2021. So, I'm about 14 months, lost about 115 pounds total. Have had a number of successes with comorbidities, no longer requires CPAP. I was on three blood pressure medications. Now I'm on one. May be able to get off that within the relatively short future. Was pre-diabetic, no longer pre-diabetic, and so all of those have been just huge wins for me. Couple of surprises along the way that I would like to talk a little bit about. The first is, as a physician, I've been shocked how this allows me to connect with my patients and empathize in a new way. So I'm a urologist, but I see a lot of patients who are obese, who have obesity affecting their urologic health, and who have obesity affecting their larger health. And so I engage in these conversations about weight on a frequent basis. And I often share that I have undergone bariatric surgery. And that really kind of just levels the playing field and allows me to connect with the patients, and they seem to be more receptive knowing that it's coming from a non-judgmental place, and it's really allowed me to help a lot of people. I actually saw a patient today in follow-up who's now scheduled for a sleeve gastrectomy in the next couple of months, and that felt really good knowing that I had talked with them and initiated that process. So that's been a huge win. Another surprise is how much I really hate taking the vitamins. I don't really like taking medications. I'm not really good at taking scheduled medications, despite being a physician, and I really do hate the vitamins. I've gone through a number of them. The first subset were these really large, chalky vitamins. Can't even remember the name of them. I've transitioned to these. Just happen to have them, and this is not advertisement, but these soft chew bariatric fusion multivitamins. Finally, something that I'll at least take. Not saying that I do it even close to every day, but do it more days than not. Hopefully, do get levels drawn periodically to hopefully make sure staying on top of that. But that's been a little bit of a surprise. Don't know if it's a surprise, but if I do overeat, I will vomit. This came up a few months ago. You know, got the surgery kind of in the middle of a lot of COVID stuff, and travel was still something that we weren't doing a lot of. But we did a cruise in August, Disney cruise with the kids. And, there's a lot of food around. Dinners are these multi course meals, and overate a couple of nights and vomited a couple of nights. So learning to kind of recalibrate that was a bit of a challenge. I don't know if it's a surprise, but some old eating habits still haven't totally gone away. Stress eating, using food when I'm having trouble sleeping at times. Definitely better. Definitely can't take in nearly the volume, but the bariatric surgery as a tool is not necessarily a reset of your brain in all areas of your relationship with food. So while it's helped a lot, there's still some areas where I have to kind of behaviorally be aware of what's going on, and have even had therapy with a food therapist to try to help me be aware and stay on top of that so that I don't regress or have setbacks. The weight loss initially is just absolutely thrilling. It's vast. It is immediate. Now I'm hitting more of that plateau phase. While I'm still losing, it's definitely coming off slower at this point. So it does feel a little bit more like work than it did at first when it was just effortless. I also was surprised for me that the recovery was pretty minimal. I'm in recovery from some chemical dependence, about 9 years of sobriety there. So I was really worried about how I would, do in the post-operative period. I did end up taking like 6 Percocet over the first 3 days. Found I didn't really need them after that. Definitely had some abdominal soreness, but really after the first couple of days, pain was pretty minimal. and was very thankful for how I did. I will emphasize different surgeons have different thoughts about using narcotics in the postoperative period. I was not opiate naive, and I think that increased the likelihood that I would require a little bit more for pain management uh, in the immediate postoperative period. You know, still early, obviously on my journey, but it's been a huge win so far. I'm extremely thankful for where I am with it and would absolutely do it again. And look forward to what the future holds. It's kind of restored a sense of optimism that I like getting dressed up again. I'm confident in my clothes. And all of that just feels really great. So I think the surgery in some ways is a psychic surgery too, in that it allows you to not have your life defined by obesity. And whether or not we want to admit it, the way people interact with us in society, the way people judge us, is absolutely framed around that. And so it at least has allowed some of those trappings to fall away where I can interact with people and not have that really on the table. So if you want to reach out to me, just put some comments below. I'd be glad to answer any questions. But this has been a life changing surgery for me. And I would definitely encourage people to consider it if a long standing struggle with obesity has been part of your life.